All right. Well, I tell you what, I'm going to go ahead and get my guest introduced. My guest this morning is Patricia Strickland. Patricia Strickland began her nursing career at NYC Health and Hospitals at North Central Bronx Hospital, one of the largest municipal hospitals in the country. She has over 30 years of experience. Her first 10 years were spent as a staff nurse on a medical surgical unit. She then worked for over 20 years in the intensive care unit, and for the last 3 years of her career, she served in the emergency department at North Central Bronx Hospital. Patricia's interest in nursing began as she watched nurses care for her father in the ICU when she was a child. During her early teens, she volunteered as a candy striper at North Central Bronx Hospital. She retired from NCB after more than 30 years of service in December 2021. Patricia earned her associate's degree from Helen Fuld School of Nursing in New York City in 1993 and her BSN from the College of New Rochelle in 2010. As a staff nurse, Patricia participated in the nurse preceptorship program. Through her role in the nurse preceptorship program, Patricia mentored dozens of new nurses, helping them transition confidently into clinical practice. She demonstrated a strong propensity for teaching throughout her career. She earned her master's degree in nursing education from the University of Phoenix in 2016 while working full-time. In the fall of 2016, she entered academia, teaching in the skills lab at Passaic County Community College. In 2023, she accepted a part-time position as a clinical adjunct at Bergen Community College. Currently, she is a half-time faculty professor at Felician University School of Nursing. Patricia is married and has one daughter. She enjoys working out, reading, and traveling. Patricia has been a part of the Black Women of New Jersey, BWNJ organization since 2024 and was inducted into the Sigma Theta Tau Alpha Beta Chi chapter in 2024. Ladies and gentlemen, welcome to the Reading Circle microphones and airwaves, Patricia Strickland. Pat, good morning.
Good morning. Thank you for having me.
No, thank you for rising early to join me, because those of you in the listening audience, Patricia had a book signing. Pat had a book signing last Saturday. Just like if you remember my guest, Donice, last Saturday, she had a book signing as well. Well, Pat had a book signing last week as well. And her book is A Guide for Nursing Students, How to Prepare and Achieve Success in Your Clinical Rotation. All right. So as I was sharing with you when we were talking earlier, my first question usually is along the lines of, and I see in your bio, you got interested in nursing as nurses took care of your dad when you were a little girl. So as you were thinking about being a nurse and wanting to become a nurse, did it ever cross your mind? Because I also saw in your bio you like reading. Did it ever come into your mind that you were going to be an author?
No. No. I've read many of articles and dissertations and reading books. Never thought that I would write a book myself. I fantasize about it, but not actually thinking that I would be able to do it. Not at all.
Now, see, that's interesting.
Yes.
And I cannot tell you, because this is my 25th year, this is my 25th season on the air, and I cannot tell you how many authors I've interviewed who said, matter of fact, they didn't even consider themselves authors. I was like, you got to be kidding me, you wrote a book, you're an author. But a lot of people tell me exactly that, like, that was not in my plan to become an author, but yet they did. So when you said you always enjoyed reading, so because the name of the show is The Reading Circle, because it's about reading. Tell me a little bit about, as a child, what caused you to be interested in reading as a youngster?
Many things. For number one, not allowed to go outside too often, and my mother always came in the room and, here's a book. I went to the library, read this book. And I felt like reading always took me to different places. As you know, when you're reading, you get to experience another place, another time, emotions, feelings. You're just learning about things that you just was curious about. So for me, reading was very easy. As we spoke about our show, we do a little book reviews together. So to be an author, to become an author, to write a book, to gather that information to take someone to another place, I never thought that I would be in that position. Never thought about it. But it fell in my lap. As we spoke about my bio, when I started doing clinicals, I had no idea, like, where to begin with my students in the clinical area. And I went and I seeked out a book, How to Be a Clinical Instructor, so that I can get an idea of how to structure my days with my students. I read this book, and it helped me to prepare my students' clinical day. And so it gave me the idea, if this book can prepare me, why not I write a book to help prepare my students?
Now, in terms of nursing, because you were an actual nurse, you're not just instructor, you actually did it.
Yes.
Now, see, this is my thing in terms of anybody in the healthcare, like anybody that works in hospitals, anybody that works in the nursing homes, so forth. To me, that is a true calling, because I know for me, I could not do it. I mean, I've been in hospitals. I've done visits. My mom was in a nursing home for about a month or two whenever she was on her last, right before she passed. And, I visited there and saw what all the nurses and everybody there had to do. And I'm like, that is a calling, because everybody can't do that.
I hear that often. A lot of people go, I don't know how you do it, Pat. I can't do it. And I think the idea of compassion and, just giving of yourself, I could say, again, from my mom. My mom is 6 of us, and watching her take care of us. And when my father felt ill, and going back and forth, and I had to be about 8 or 9 years old at the time, and going to the hospital, and even at home when my dad was home, and I can see him taking his medication when he was supposed to, not really understanding what was happening. But I can see how my mom was taking care of my dad. My dad had really bad high blood pressure and high cholesterol. And I'm thinking, like, the nurse probably spoke to my mom, listen, you have to change your diet. Because I can remember we're sitting at the dinner table, and we all would look at each other like, what is this food? It looks funny. It looks different. Everything was green and light, and it wasn't fried, or it wasn't little butter and greasy. We were like, what is happening? So I guess they probably told my mother, salads, and bake your chicken and not fry it, and no bacon, no ham. And so that was the beginning of, healthcare and taking care of yourself. And to this day, my siblings, you won't find, the traditional salts in our house, You won't find, certain things and frying foods. And often, we all the same, all of us. We take care of ourselves and making sure our diets are good, and not frying foods and not eating greasy and and things like that, because of how our lives have changed at that time. So I think that was the beginning of the healthcare for me, and taking care of others, and then visiting the hospital. And I was saying my dad was in an ICU, and I guess the doctor might have called my mom and said, listen, it doesn't look good. Bring the kids, come in. And I can remember we're standing there, it was glass window. So to me, it was it had to have been an ICU, intensive care unit. And my dad was turning his head, looking at us. But there was this woman, circling his bed. And, I'm trying to look at my dad, but then I'm checking her out. What is she doing? What is that? Later learning, that there is, this person that is at the bedside, caring for people when they're sick and ill or whatever, And I became curious with that that role. To me, it always stuck in my head. But I think what solidified it for me. I could remember me and a friend was like playing jump rope in her yard. And her mother and her friend, like, they drove up and go, "Oh, look at the nurses." And it stuck with me. Like, it like, solidified it. So
Well,
even with high school, my ring had the medical emblem.
Mm-hmm.
Yes. So it was always with me.
So it was almost as if, to a degree, it was meant to be. But that's why I say because, again, it takes a certain type because for me, I have a hard time seeing people suffer. I have a hard time hearing people hollering out in pain. Like, that's very challenging for me. So that's why I mean it's a calling. I have a hard time with the various smells and everything that comes along with being in the hospital. And that's why I say I was just in the hospital yesterday because my sister's in the hospital at the moment. And I was just in there yesterday. And as I walk through the hospital, I look in the rooms and I see the people in the beds. And it just tears my heart out to just, and a lot of times I visit people in the hospital. I actually leave out feeling better probably than I made them feel because they're in there and they'll make me laugh or either they'll say something funny or they're just so happy to have the visit. So a lot of times I will leave the hospital feeling better than I did whenever I went in there. As a matter of fact, the person did more for me probably than I did for them. But that is a calling because I remember, like I said, my mother's last days when, I went to visit her in the nursing home and she would be yelling and she would be hollering and the nurse would come in and she would have to be changed and she would have to, I was like, oh, that is a calling. Now, on the other hand, I think everything to a degree is a calling because I'm a school principal. And I have had police officers, armed police officers dealing with an issue in the school or whatever, look at me and say, "I don't know how you do it." And I'm sitting there looking at them like, I don't know how you do it because if I had a gun, I'd be shooting up everybody. And so in any event, I think what all of us do is a calling, but what you all do in terms of the medical field, in terms of healthcare is so critical. Now, it's funny you were talking about changing diet because a few years ago I was diagnosed as pre-diabetic. And so the doctor was pretty much like change or die.
Yeah.
And it's kind of like whenever it's put to you that way, change or die. Okay, I'll take change, doc.
Yeah, it's what we put in our bodies that ultimately, decides how well we take care of our organs. And what I say to people is like, you buy a brand new car, what are you going to do with it? You get the tires changed, you get the brakes checked, you get the oil changed. And that's the way we need to treat ourselves. We need to get our checkups. We need to make sure we check everything, do the blood work, and eat well for the organs to work well and inside as well as your mind and speaking to friends and keeping healthy relationships all play a role in how we take care of ourselves and, having good, effective outcomes in our lives. Forever how long we are here, we want to be healthy.
Correct. I mean, you are sorry because see, this is the thing. My father passed away prematurely in terms of he had a heart attack, massive heart attack, 1 week before his 49th birthday. So he was 48. Yeah. It was like 1 week before his 49th birthday, had a massive heart attack that literally took him out. And from that point on, because you know how, again, African Americans in particular, we're kind of leery of doctors based on historic, experiments and everything else that goes on with systemic racism. So we're kind of sluggish about going to the doctors. But after that happened to my father, I make sure I keep up with every last one of my annuals. I mean, in terms of vision, in terms of my dental, in terms of my annual physicals and colonoscopies and everything else that's supposed to be done, on a periodic basis. Because just that example you gave of the car is spot on. It's the same way you want to keep a car up is the same way you want to keep yourself up.
Exactly. Yes.
So talk to me a little bit about, because what is the day in the life of a nursing student? What is that? What is the day in, because I want to go from a day in the life of a nursing student to a day in the life of an actual nurse once they've done with school and they're a nurse. What's a day in the life of a nursing student?
I find, and I can still even remember from my days as a nursing student, it's very challenging. It's, struggles, it's uncertainty, it's competitive. It's all of these things that they're walking around with. Even, like I said, I remember still from my days as a nursing student. And, the studying, You're missing out friends. You're missing out. You're in this bubble, and you're just not sure what's going to happen. You just have to study. You don't know what the professor's going to put on the exam. You try to form groups. I remember I was in a group, like a study group, and we all tried to, map out all of the material we learned and just trying to memorize and understand everything that was thrown at us. And it's like semester by semester, but you start to see the sunshine as you're making it through each part of your education, and you start to make it through. Some of us, I've failed out, but you can regroup and you see where your weaknesses are. You boost those up. Whatever your strengths are, you make them stronger. You go back and you challenge yourself again until you make it through. And so what was interesting, at the time I was I went to Helen Fuld only because I got most of my nursing education from Borough Manhattan. And I made literally 3/4 through the program. And OB and maternity was not my strong point. I was a young woman, didn't have any kids. So it was really hard to grasp all of that information about maternity and peds. And I didn't do passing, but I didn't do bad, but I didn't pass. And at that time, they took all the students that got like a 70 and a 74.9. Because we had so many classes previous, they allowed us to sit for the LPN exam. I sat for the LPN exam and passed. So I'm like, okay, I'm still in the game. I worked like a year, and so Helen Fuld School of Nursing at the time was a 1-year accelerated program for LPNs. You come in and you have 10 months to get your associate degree, and you can sit for the boards and get your RN license. And at that time, that was my opportunity to strengthen my strong points and strengthen my weaknesses, and I did that. And when I went through Helen Fuld School of Nursing, I was like in the top percentile. I was going through the program, and I made it. I did it. Got through and worked as an RN. And so it doesn't stop there. I'm saying I have my associate degree, but I'm still craving to advance myself. I'm still feeling like I'm not fulfilled. And of course, College of New Rochelle, then I entered there and did my BSN. And you still go through the same feelings and emotions that I just got through. The uncertainty, the studying, the challenges, the struggles. You go through it again. But you're a little bit more confident because, we have our RNs. They had 2 tracks for freshmen, and they had a track for a bunch of nurses who had associate degrees coming in with their license.
So I'll tell you what, while you're going through, because you've thrown out 3 different acronyms that maybe the listening audience may know and may not. I've heard LPN, I've heard BSN, I've heard RN. What does each one of those acronyms stand for?
Yeah. So LPN is licensed practical nurse. And they are usually like 2 years education. They're right under the RNs. They do not assess. So the education is limited under LPN. So you need to go back and get that assessment and research skills, which they do not teach LPNs. And I hadn't reached that point, but I had enough education to sit for the LPN, passed it, and then I continue on to my bachelor's degree. So I did mention associate. So associate degree is AAS. BSN is Bachelor's of Science for Nursing.
So now when you get to registered nurse, so you have your license, that's what you were saying, they don't have the ability to assess or they can't assess. When you get to registered nurse, what can you do or can't do?
So, yes, so that's the full, you're assessing patients, you are doing research, you are, well, now we have advanced nursing. So it's particularly doing assessments and research. Because the research gives us the opportunity to cover those gaps. We are trained to see where the lack in the care or the poor outcome of patients, what can we do to improve that? And that's our training as registered nurses.
So now do you do, like I know doctors and everything, they do residencies and internships and all that. Is that a part of nursing as well?
Absolutely. That's where clinical comes in. Most hospitals do have some internship programs for nurses. Can come in 6 weeks, 8 weeks. For those nurses who are about to graduate and potentially be hired by that institution as well. They come and they work and they get their hands-on experience. They are precepted with another RN on the unit, follow them, actually working, actually doing everything as a nurse just before they graduate.
So in that profession, because there's one who shall remain nameless, who said nursing and teaching and education, all that was not a profession, which I vehemently disagree with. You literally have life and death. You're dealing with that on a daily basis. What is that like in terms of like 1 minute you're in a patient's room, they're here, the next day you come back, they're gone. How do you deal with that?
Gosh, just thinking about that, that's really difficult to answer because I'm not sure if we know that this happens and we just handle it.
Yeah, it's almost like it's a part of, you can't, in that profession, you almost can't take it personal or you can't get attached or close because at any given time it could happen. And like I always tell, like I told you earlier, I know for a fact that's not my calling. I could be, I could work in the mortuary. I can be a mortician. Because people laugh at me when I say that. I could deal people dead before I can them suffering. So like, I have no problem being in the morgue. I have no problem, like I said, embalming. I have no problem dealing with dead bodies and this and that. That does not faze me. However, like I said, to go in a hospital and to see people struggling and suffering, that just, it gets to me. So that's what I'm saying. You're now, 1 minute you may be talking to a patient on Thursday and then come in on Friday and they've passed away.
Yeah, I have gotten emotional a few times, when I'm taking care of a patient and they're declining and things just didn't go well. I don't know if you just build up just handling that opportunity,
right.
that moment,
right.
But you're there to support the patients, particularly also supporting their families
Correct.
in those difficult times, But I can recall being emotional. We have debriefings most times on a unit if we had a patient that was there for a very long time and we have become like family with the family and
Correct.
just supporting with them, and we talk through those challenges. We talk through those times where we just have to just learn how to make changes in the way we handle each patient when we are comforting them. And we came up with different structures on units where if a patient is not doing well, we may light a candle at the door for that moment just to let them know, like, maybe this is a time where they may be transitioning to give the family some privacy, make things a little bit more understanding that, life and death, it's a continuum, and it's emotional for us and, as well as the family, but it's still time for us to care. It's still a moment that we show compassion. It's
Correct.
Still a moment where we have to, it's not like we have to, but it's like we're there. We're there for the family. We're there in any capacity that we could be to make things easier and have them ready for this moment for the family.
So listening audience, go ahead.
Uh-huh.
No, go ahead. I was getting ready to introduce you again, but go ahead.
Yeah, so, nursing, when you think about nursing, it's an art. So you are constantly assessing for situations where you're caring for patients and you have to think of each patient as an individual. And in that individuality of that patient, their care is custom for them. And when you do that, that's where you are showing each patient that we have you in mind. It's not that you're like on a machine, like a belt. You are individualized. Whether you have high blood pressure and then one patient next to you have high blood pressure, you're going to be treated different from this patient because I have to take a lot of things in consideration. I have to take in consideration of your background, your culture, your family situation, your financial situation. All of these things play a role in how I'm going to take care of you.
So listening audience, I hope you've been with me since 6, and I definitely hope you've been with me since 7, since my guest has joined me, and that is Patricia Strickland, MSN and RN. We're talking about her book this morning, A Guide for Nursing Students, How to Prepare and Achieve Success in Your Clinical Rotation. Now, I'm assuming, I don't have to assume, I know, there are different facets as a part of your nursing education. You specifically zoomed in on clinical rotation, right? What are some of the other parts of the education, and what is clinical rotation?
So the clinical rotation is the part where nursing students actually now they have been in a classroom. They've been learning skills. They've been learning content, all of the information, disease process. Now they have to translate this on a unit. We bring them into the hospital to take care of live patients. And that's an opportunity for them to now close that gap from the book, the classroom, and bring it into the unit and actually care for patients with all of that information.
See, that's something I've always wondered about in terms of like even being a doctor, like when you're first starting, the patients you're working on, like how are they not, or are they, or maybe not seen as guinea pigs per se, but how do you obviously like anything else, the longer you do it, the better you get at it. But whenever you're first starting, are you like nervous you're going to mess something up, or what is it like dealing when you're first doing this, dealing now live, like you just said, all right, we're coming from the book to real practice.
Right. And that's what prompted me to do this book, because I think, Mark, I'm traumatized from my clinical days, honestly. To think about, you're going to take care of a patient, yes, that it sounds nice. It really sounds exciting, but it's very nerve-wracking. And I remember even on my first clinical, and I have a friend, like we're best friends still to this day, I think like I got so nervous that I got sick, like physically sick. And the clinical instructor, she realized like, what's wrong with her? Someone take her to the bathroom. And like I was sick and nauseous and everything, and she had to send me home in a taxi. And I see that in my students when I'm picking them up at clinical. They look like, I was like, oh my goodness, they look like me back in the day. They look nervous. Even when I was in the skills lab, as you mentioned, in the skills lab, when they learned the skills, they were very nervous. You know, showing them how to do a sub-Q injection, IM injection, like they're shaking. Their hands are literally shaking. And it breaks my heart. Like, no, this is not time to be nervous. It's fine, relax. They would start crying. You know, so the nervousness, I felt that it occupied their thinking. You need to be focused on this, not thinking about me or what I'm going to do or anything like that. Focus on the skill. I'm here to help you. I'm here to alleviate some of this nervousness and anxiety. And so this is what actually prompted me to do this book. And it's a book, but I call it a guide. Because when they go to clinical in the hospital, they learn all the skills. So it's really a review of everything that they've learned. I speak about the nervousness, and I speak about, you know, being anxious and, you know, just feeling like they're struggling. But this is a time to relax, stay focused, and you're going to have a successful clinical rotation.
Now, you all administer needles as well, right? Needles and injections
We
and all
give
that?
injections, yes, absolutely. Yep.
Do you, like, when you hook up, like, IVs and all this, because you have to hit these various veins. You have to find veins, and or the nurses, they do that, correct?
Yes, we do.
So that's what I'm saying in terms of, like when you're starting, like, are you practicing on people, or do you practice on dummies,
Mark,
or do you? How do you get to that point where you know where to stick that needle and how to get in that vein and so forth and so on?
It's a skill. It's a skill, and it's like you ride a bike and you may fall off, but as you continue to ride that bike, you're better, right? You improve. So these are skills that they have to practice. So they practice these skills. And when it's steps you take, when you follow these steps, and you've been practicing, and you build your confidence, and you feel self-assured, you are successful. I can insert an IV and put in a line, but you know, some patients, they become difficult, and they do feel like, oh, you're going to stick me again. I always apologize. I'm so sorry. And I just tell them, oh, you have to get this. And I explain what the plan is for them, what the provider has for them. I'm so sorry. Just give me a moment. Let me try and do this. I mean, now they have things that make it a lot easier. But when patients see that we may run into a little difficulty, but when we explain and we speak to them, we include them in their care, they go ahead. Do what you need to do. We're not experimenting on you. We're not, doing anything like that. We are taking care of you. We are including you. We explain things. You're not in the dark about anything. And they know what needs to be done.
Well, again, I am always impressed because, one, I'm a blood donor, so every now and again I donate blood, and they always have to, get the thing in as the, to get the blood out and so on. And the same thing when I go to my regular doctors and labs and everything else. And I'm always impressed whenever they have to do that. And they'll tell me, okay, it's going to be a little pinch. And I'll turn away. Like, I don't want to see when they do it, but I can feel it. I've gotten to the point now I'm so used to needles and shots that they really don't faze me. But I'm always impressed whenever. And you're right. I can tell the difference between somebody who's really skilled and somebody who's somewhat skilled and someone who's not skilled at all. Because that little pinch becomes a serious hurt.
No, Mark, I understand. Because when I go to the doctor and if an employee comes in and she's going to take my blood or I can tell too, but I go, I don't want to say anything because I know that they have to get skillful also. Sometimes I go, well, if you use that vein right there, and then they go, oh, thank you. So I kind of help them out, but I turn away, I flinch too, and I go, wait, give me 1 second. If I'm getting an injection or something, I go, wait. And And they go, "You okay? You're a nurse." I go, "I know, but I just can't take a needle right now. Just give me 1 second." I'm a nurse and I'm a patient too at times,
That's right. Now, you brought up another interesting point a couple of minutes ago when you said something about difficult patients. What I mean is like, because see, I probably now my sister.
They always say give them the pat.
Yeah, right. Because my sister, could be. My sister could be like the difficult patient. I've heard her husband. I've heard some of the doctors, and she even admits she's a difficult patient. She's gotten better over the years. But I tend to would be more like, okay, I'm working with you. But there are differences between a difficult patient and a cooperative patient. Go ahead. You were starting, but go ahead.
I find what is the issue, why a patient is difficult. So I try to, first thing I do is always, and I tell my students this, I look at the age of the patient when I go in. If I go, "Oh, good morning, Mr. Medley," or I go, "Hey, Mark, how are you today?" When you say your name, that, they always say that's the best music and sound.
Correct.
Say the name and, develop that nurse-patient relationship is so important. And come real and come correct and come knowing who you're dealing with. So I take time and I read what happened to the patient, what their history looked like. Let me have some insight into this patient, not just come in and just, well, you have to take this. I like to give them eye contact. I like to say their name and just not rush to do things. I like to listen to their story. The difficult ones, you have to take your time with them. And when you develop that relationship and that understanding, and I explain everything to them and not feel rushed and not judge them, they become easier to handle at that time.
Now, see, I couldn't agree with you more in terms of, because there's a flip side to that, too. Just like you can have a difficult patient, you can have a difficult nurse. Now, I have seen where, like, again, I was there the last few days of my mother's life, the last few weeks I was there. And there was every now and again we get in there, hey, that's a little rough there. Can you do that a little bit softer? I mean, like my mother would say, when this one comes in, I'm scared, or this one, because she was suffering with dementia now. So she would tell me, the ones that were very nice and the ones that she was kind of scared. And so I happened to be there one day when one of the ones she was scared of came through, and I said, I see why. And so... it's two ends of that coin. And if the nurse does exactly what you were just saying in terms of establishing that relationship, it could be. Because I guess you get to the point where now, this is what we were talking about earlier. And whenever I was asking you a question about, when a patient passes away, you don't want to get to the point where you get so jaded that it's just like, it's not a person, it's a thing. It's like, this is what I do. It's my routine every day. And you're almost like anesthetized to the fact that you're supposed to be compassionate. And so how do you even keep that? Like, how do you keep that from happening? Okay, this is my job. This is what I do every day. And you just, it's just kind of on autopilot.
Again, I just make sure that each patient is a priority. And you have to think of life and death as a continuum. And so just how you're taking care of them alive and as they are maybe transitioning, your comfort care. So as long as you realize that it's a continuum, because what are we going to do? I mean, death is a part of life.
Correct.
And we are trained like that. So it's inevitable.
No, correct. Because like I said, that's why, back to the relationship thing, like while they're there, I mean, it's like that comfort, like I said, I'm going to continue to go back to this whole notion of being a calling. And I believe it's a special calling because you have so many things that has to be in place. First off, you have a patient who's sick that most likely is struggling, don't want to be there, don't want to be sick, not feeling well. And so now the healthcare folks have to come in and, like you said, be compassionate, be consoling, be comforting, and all of those things. And every nurse, it's just like any other profession, is not doing what you're describing in terms of, okay, I'm going to make sure that, I'm going to make this person feel well. And that's where I was going to a couple of minutes ago. For some people, okay, it's just a job. I'm doing what I need to do, so forth and so on. But for the ones who do what you're describing, it does make the experience so much better.
So much better.
I mean, I've only been thank God, the only time I've been in the hospital was as a child. I remember I had convulsions when I was like 8, 9, or 10 years old, but I've never had a long hospital stay. A couple of years ago, I had a hernia surgery. It was same-day surgery, but I can remember the nurses and the doctors were so comforting. It was a wonderful experience. Yeah. So you want the patient, even though they were sick or they had surgery, you want them leaving with, I know I was sick, I know I had surgery, but it was a wonderful experience compared with, man, I was sick and that doctor and that nurse, they were terrible. That's what you don't want because it's like anything else. And I'm going to ask another question because it's interesting because
No, Mark, I've gotten frustrated over the years. Sometimes where, you have to drop whatever personal, you drop it at the door.
Right.
But I can remember many times, actually, all through the years, in the ICU, I'm titrating drips,
right.
according to your blood pressure, giving you medication, informing the doctor, the heart rate is going up, going down, the anemic, you got to give blood, you're back and forth, put the Foley in, what's going on, giving fluid. IV, start another drip, put up another. You're doing this back and forth, and the family would come in. What is that stain on the bed?
Yeah, now see, that I could see where it would be frustrating because it's like, whoa. And that's where, that's where I was going with my next question in terms of nursing is kind of going through the same thing that teaching is going, that education is going through, where we have a shortage. How do you now, or what do you do in terms of encouraging people to go into that field? Because like I said, with teachers right now, we have a teacher shortage. I mean, to try to hire a teacher now is extremely challenging. And I know in the nursing profession, they had similar challenges.
Yeah.
What do you do in terms of?
Nursing is definitely has always been under a threat, shortage. People always question about what we do. They're not sure, like, what is it that they're doing? They just have this big curiosity. So I don't think the public, knows what we do. I don't think it's out. I mean, I think after COVID, honestly, we got the big name. Before that, people were like, what's a nurse? Like, what is that? And not really considering that profession only if I find if you had a family member or mother who's a nurse, many times I've worked with, a friend's daughter, she's graduated, or first-time generation nurses who they understand that profession can give them a leg up in terms of, a good career, making some good money, and they choose nursing. But the public didn't really have a good idea about what we did until after COVID happened. Anyone who talks to me and I speak to young adults, I always recommend nursing, with the flexibility, the good pay, the transition in nursing, where you can, it's not just like bedside nursing. You're not just at the bedside and cleaning patients. There are so many facets of nursing today that you can use any skills that you have to help, in the care of patients today.
Well, you just gave off a laundry list when you were talking about the frustration question. You gave off a laundry list of things that nurses do. And you were talking about the drips and the this, that. I mean, it's a lot of responsibility there that a lot of times the doctor gets all the attention and the nurse kind of gets downplayed. But the nurses, it's like a team. Like you need both. Course, you need the doctor and the nurse. And a lot of people will put so much emphasis on the doctor and kind of downplay the role of the nurse. But I just heard you give a list. And that was a short list of things that the nurse have to do. Not to mention, like I said, going back to the compassion and so forth and so on. So, yeah, it is a worthy. I have a cousin. She retired some years ago, but for like, I feel like 40, probably darn near 50 years. That you were talking about being the nurse and the birth, when the kids are born. That's what is that? The which type nurse?
Well, you have
the one right when the babies are born. When the babies.
Yeah, that's maternity.
Okay,
that's
she was the nurse. I mean, I can't tell you the number of like grown-ups now who she was in the delivery room when they were born, and they would come to her, or she would say, you know what, I was your maternity nurse whenever you were born. I was there. But she did that for a good probably 40, 50 years down in Virginia. She was a maternity nurse. But it is a worthy profession, and it is a required profession. Like I said, a lot of times it's just like anything else. It's like if you're in the entertainment business, the singer gets all the attention, but you got the band, you got the musicians, you got the setup people. Nursing is the same way. It's a part of the entire team that keeps the person well. And
definitely, it's multidisciplinary that work together to ensure that the patients have the best outcomes. And we understand that. Like, I don't know what I do without my pharmacist. Here it is, a physician may order something, and I'm like, what? Trying to look this up. I call my pharmacist. Can you give me a little bit of insight about this drug, before I give it? And, okay, I need that. Oh, dietary. Listen, this patient said that they have allergies to this. Like, here's the nutrition. She's telling me, give it before they eat.
Right.
Hey, let them take it before they have their foods or whatever. Blah, 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 blah. Don't mix it with this or that, And then here is, you have pharmacy. Then you have the social worker. I have a patient. They can't go home. They have some issues in the house. What am I going to do? I'm doing my discharge plan, and they're making it difficult. They're absolutely not leaving. They're challenging the discharge right now. Is there anything you can do to help them out? Okay, we can fix that. They can stay another day. We'll get that. We'll have physical therapy come in. Physical therapy, here they come. They'll tell me your patient can't go. Something is going on. So it is multifaceted that we work with other disciplines that also, yes, help us to ensure that the patient has the best outcomes when they leave.
So over the years, we've had more male nurses because at one point, there was the stereotypical nurse in the white short skirt and the little white hat and so forth and so on. But over the years, more men have entered the field.
Yes, the image of nursing is changing. And it's funny you say the short skirt because, the American Nurses Association has always looked at the foundation and the image of nursing. And whenever, I don't know, you're not going to see it much, but it used to be like ads of these nurses with these really short skirts or these cleavage and things like that. They want it removed. They got it removed. I don't know if you noticed, but even the costumes, you won't even see these kind of sexualized images of nurses because they don't want that to be like that's what a nurse do to go in the room or in the bed or something. Like that's not the image of registered nurses. And when you're speaking about how males, yes, absolutely. Over the years, you have seen male nurses, and I think the percentage is coming up to 12 to 15% now of male nurses coming into the nursing profession. Like typically in my class, if I have a clinical rotation of 8, could be 3 out of the 8 are males in my clinical rotation.
Well, this is the thing. There's not, and I know we do this, but in general, sexuality is not tagged to that. So just because you're a male nurse does not mean you're a male, or does not mean you're gay, or does not mean it does. It just means I'm a male nurse. I remember I was a male secretary, and I was back in the 80s. I would catch the business because I was a male secretary. But it has nothing to do with gender.
No, it has nothing to do with gender. It was because it was heavily populated with female, so they looked at nursing as, it was female-dominated profession. But over the decades, absolutely males are coming in and doing nursing. They're coming in by the numbers now. And they don't, when I have my male students, or even when I was working alongside male nurses, it's no thought about their sexuality at all whatsoever. None at all.
I was a male secretary in 1985. I was a male, 1985, 86, somewhere. I was a male secretary. And it would be the funniest thing when people would call in and they would ask for my boss's secretary. And I said, you're speaking to him. And they would, oh, my God. Oh. May I speak to Mr. Such and Such secretary? You're speaking to him.
Right. I think it could be a little shocking because, it was female, but it's the same with police officers when women started coming in, and firefighters when female firefighters started coming on board. So it's like, oh, okay, like we could do that. Yes, you can. You can absolutely do it.
Well, at the end of the day, giving care, I mean, I guess in general, the thinking is that females would be more compassionate. That's not necessarily so. But at the end of the day, giving care does not care what the gender is. I interviewed a captain, female pilot. I'm an AV geek. I love aviation, and she was a captain. And when all is said and done, the airplane could care less who's sitting in the seat, as long as the person knows how to fly, whether it's male or female. And it's the same thing with nursing with care. The putting in the needle itself and all the different things you have to could care less about the gender who's doing it. It's just there's a job that needs to be done. And like I said, the sexuality and gender and all is really, but that's what people they try to associate that with that, and it's not true. I mean, I've had both male and female nurses. So, and same thing, like I said, I was just in the hospital yesterday. My sister she's had male and female nurses. So it really doesn't matter.
There are some patients that feel, particularly like the older elderly women, they always request for a female nurse.
Well, that makes sense.
That sense, yeah.
That makes sense to me because you're just more comfortable with it, because with everything going around now in terms of abuse and so forth and so on. So that I can see, that I can understand. And not to mention, sometimes you may not. And you know what? That brought up a very good point as well. What do you do to protect yourself from being accused or set up in a way that it would make it appear as if something like that happened? Because that is something we got to be mindful of. You don't want anybody accusing you of something like, no, I'm just doing my job.
No, I've never thought that I had to protect myself. I've never thought of it. If I was going into, give care to a patient or assist patient, I have never thought of anything like that. If they call and they need help, I'm here to help you. I know because when I go for a doctor visit and I have a male physician that will come in, they will always have like a nurse there to protect themselves. I get that. But as far as in hospital inpatient giving care, I never
that's a good thing.
To protect myself. Never.
So I'm going to shift gears a little bit, go back to your book. So now that the book is written, how do you feel? I mean, you actually have a book now. I'm looking, I love the colors on the cover and everything. It has your name in it, Patricia Strickland, MSN, RN. How does it feel now to be a published author? Especially since
I still cannot, I still cannot believe it. But it took me to see that gap. And my own personal, like I said, I think I'm still traumatized, to say I need something to help boost my students in their confidence when they come to clinical.
Well, let me applaud you because I'll tell you why. I know people will always say, Mark, do you always have to introduce race into it? Yes and no. But I applaud you for having an African-American nurse on the cover.
That's me. Mark, if you see me, that's me.
It works for me, whether it's you or the fact that, see, again, because people would not immediately make that leap unless you almost force them to. And so I
Actually,
applaud
did with
you.
my publisher.
I
did.
applaud you for putting an African American nurse on the cover.
Yes.
Because people, again, kids need to see, children need to see, they need to see people who look like them in professions
Yes.
that people try to tell them that we're not. One of the problems I'm having with the nameless one is he keeps trying to erase the contributions of other folks who don't look like him. So it is critical and crucial that children and as well, not even adults, see that, yes, there are black doctors, there are black nurses, there are Indian doctors, there are Indian nurses, there are Asian doctors, there are Asian nurses, there are so forth and so on down the line. So I applaud you for having a black nurse on the cover of the book.
Thank you.
You had a book signing last week. How'd that go?
It went better than I expected because I didn't know what to expect or who was here to support me or what. But seeing the faces of few students, the faculty, my friends, my family, to be there to support me was amazing. It was truly amazing. And the thing is that when you're in the moment and you're thinking like, what do I do at this time? But everything is flowing. I'm introducing people to each other, my family to the faculty, and they're asking about the book because what happened, I only had a few copies. So I was supposed to sell the copies, but my publisher is located somewhere in California where they had a snowstorm, and so all the copies weren't there on time. So I was able to speak about the book. I had a few copies, like I said. He sent like 4 copies previously, and some faculty was going through the book, and they were like, "This is great, Pat. It's very easy for the students to comprehend. It's not like overbearing or, it's paperback. They can slip it in their back pocket, bring it with them to clinical, review all the aspects in it." And I have a quote from Maya Angelou, like on the 3rd page. "Do the best you can until you know better. Then when you know better, you do better." And that's what it's about. It's about knowing better to do better. So the book sign.
Go ahead.
So the book signing was, like I said, it was better than what I expected, but what made it extra special was everyone who was there to support me, just listening and the cheering when I spoke about the book. It was such an amazing feeling. Such an amazing feeling. I'm still like on high.
So the target audience, are you looking for the book to be in colleges and universities and nursing schools, or are you looking for the student to go directly to the nursing students, or a little bit of all of it?
Yeah, I envision, my book is a resource. I envision it to be used like a supplementary tool in nursing programs. It could be a self-study guide right before students begin their clinical rotation. If instructors would like to recommend the book to their students who are beginning clinical. Many times when they start clinical, it's like a break, either summer or like right now, like we're going to have the Christmas. Many of them that are going to come back for the next semester are going to start clinical. This would be a great review just before clinical, preparing them for their fundamental exams. My book is a good, quick reference. So, I'm hoping that it can reach faculty that can recommend for their students who are preparing for clinical. This is a great guide for them. Mm-hmm.
All right. Well, believe it or not, our hour has gone by, and I get to this point now. What I do is I allow you to promote in any manner you choose in terms of telephone numbers, websites, book signings, appearances, so forth. The only thing you cannot say is a dollar amount is the price.
Oh.
That's the only thing you cannot say, because that folks can work out with you when they get in touch with you, if they buy the book, whatever it costs, this, that, and that. But short of that, you can shout folks out. You can, again, give all your contact information, whatever you'd like to say. I'm going to turn the mic off for a few minutes, and it's yours. And that point is now.
Okay. So a guide for nursing students, how to prepare and achieve success in your clinical rotation. My book is filled with reviewing basic skills, medication updates. You can find my book on Amazon, Barnes & Noble. There's an ebook as well. My website is patstrickrn.com. It's available there. I'm going to have other resources coming soon, how to review EKGs, how to understand disease process of many, many diseases like congestive heart failure, myocardial infarction. That'll be coming soon. So, it's available now on Amazon.
Well, again, I thank you for rising early. Big shout-outs to Dr. Darshell DeBow-Stone.
Yes.
She got in contact with me and says, I have a friend that wrote this book. I said, I got to have her on the show. So I thank you and thank Darshell. And again, I wish you nothing but the absolute best. Again, if you are a nursing student, the name of the book is A Guide for Nursing Students, How to Prepare and Achieve Success in Your Clinical Rotation. And the author is Patricia Strickland, MSN, RN. Again, if you're going there, and I pray that, because like I said, I know what we're going through in education and trying to get teachers. So I can't imagine in the medical field of trying to get nurses. Because I tell you what, this is the thing. Like we were talking earlier about, how people view these various positions. I tell you what, let these positions not exist and watch how things go.
Yeah, I'm sure they know. I think COVID has, like I said, COVID, I feel like officially put us on the map. And since COVID, they have said that nursing attendance, admissions has gone up. And they see the work that we've done. They realize that, yes, we do make a difference. They realize what we actually do.
Right.
So, nursing is here. It's a fulfilling career. It can be challenging, but it's innovative. It's empowering. It's so insightful into people's lives, and
it is a profession.
And it is a profession. No matter what, who's trying to take away, it is a profession. I'm not even giving that any attention.
That's why I didn't get into the discussion about it, but let it be known, it is a profession.
It's a wonderful profession, a wonderful profession. I love my nursing.
I know that's right. Well, I tell you what, again, I thank you so much. I will get the copies of the YouTube as well as the MP3 link to you. And once you receive that, you do whatever you'd like with it. Share it however you would like to.
Thank you, Mark.
All right.
It's been good. I enjoyed it.
Good. I'm glad to hear that. Have a wonderfully blessed day, week, and holiday season. And I'll be in touch with you. All right?
You too. Have
All
a good
right.
day.
Take care.
Bye-bye.
Bye now.
Bye.